we are going to talk about diabetes type 2. Sarah, me, is going to talk about the biology of diabetes, what is affected by it. Laura is going to talk about a healthy lifestyle to prevent this disease and other cardiovascular diseases. And finally, Jorge is going to talk about exercise as a way to prevent diabetes. Diabetes type 2 occurs when your fat, liver, and muscle cells do not respond to insulin. This is called insulin resistance. This photo here we will explain afterwards when we know a little bit more about diabetes type 2. Now we're going to talk about the pathophysiology of diabetes. First of all, when you eat, or when we eat, your body breaks food down into glucose. Now, what is glucose? Glucose is a type of sugar, and it's also your body's main source of energy. Here we've got a diagram explaining type 2 diabetes. I'm going to read it to you in case you can see it. First, the stomach changes food into glucose. Secondly, glucose enters the bloodstream. Third, the pancreas makes insulin. 4. Insulin enters the bloodstream. 5. Glucose can't get into the cells of the body. Glucose builds up in the blood vessels. As a consequence of glucose building up in the blood vessels, our blood glucose rises, and the body sends a signal to the pancreas to start releasing insulin. Here we've got a diagram, and we can see that as your blood glucose rises, it also does your insulin. Here we've got the diagram of an easily digested carbohydrate, this being your glucose levels and this being your insulin levels. And the other diagram is from a slowly digested carbohydrate. Again, the red line being your blood glucose level and the green line being the insulin level. As you can see by these diagrams, insulin and glucose rise and decrease more or less at the same time. This shows how should insulin work in a normal situation. Acting as a key, insulin binds to a place on the cell wall, an insulin receptor, unlocking the cell so glucose can pass into it. There, most of the glucose is used for energy right away. But what are the problems in diabetes type 2? Your pancreas may not produce enough insulin. There is an insulin deficiency, or your cells don't use insulin properly. The insulin can't fully unlock the cells to allow glucose to enter. So there is the insulin resistance. This photo is the one shown at the beginning, and here we can see how glucose is not able to pass through and into the cell. Diabetes type 2 is more common and affects people who are overweight, are 45 years old or older, are physically inactive, have a parent or sibling with type 2 diabetes, are African American, Native American, Hispanic American, or Pacific Islander, have abnormal cholesterol levels, have had gestational diabetes or given birth to a baby greater than 9, have high blood pressure. These are the chronic complications of diabetes. What can it cost in further time? Blindness, kidney disease, nerve damage, amputation, cardiovascular diseases such as stroke, heart attack, loss of circulation in arms and legs. Now we're going to see a video which will show you more interactively how diabetes type 2 works and how it is produced. There are two forms of diabetes, type 1 and type 2. Type 1 typically begins before the age of 40. Patients with this form do not produce any insulin themselves, so must take regular insulin injections. In type 2 diabetes, there may not be enough insulin or it may not be used properly. Type 2 is linked to genetics and, often, to being overweight. It usually affects older people, although it is increasingly seen in overweight children. Type 2 diabetes occurs when your pancreas does not produce enough insulin and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream, where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications, such as heart attack and stroke, blindness, kidney failure, and nerve damage. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of developing complications from diabetes.